Today, we will be going through a demonstration of the broker site that you do have access to through Health Plan Markets. What you are currently seeing on my screen is once we have logged in as an agent, we will be immediately sent to the Search Beneficiaries page. So we have done a lot of research with both agents as well as current clients to really understand what they wanted to see within this system. And we do want to stress the searching of a beneficiary right off the bat. So if we do have a built-out profile, we can always search on that profile and pick up from where we've left off. However, if we do know we are speaking to someone that's new to our book of business, we can always create a new profile at the top of the screen. There is also a fast pass option throughout the system. Say we didn't want to create a profile and we just wanted to see the plans within that individual service area. At the top of the screen, we do have a plans button. If we were to select plans here, it would open up a window prompting us to enter that beneficiary zip code, and it will take us directly to the plans list page. Also, now found at the top of the screen is the agent dashboard. Within this dashboard, agents will be able to see outstanding tasks associated with enrollments, electronic quotes, scope of appointments, MyMedicare.gov connections, as well as any other tasks we associate to a profile. So now as we do actually move through the system and perform certain functions, as you will see later on, a window will pop up allowing you to create a follow-up task, which can be tracked again here within the agent dashboard. Also within this dashboard, we do also have a reports tab. Under reports, this would give the agents the ability to search on a date range that is 7 days or less, where they can look at outstanding enrollments as well as scope of appointments in a report view. So everybody that is in their book of business. Also within the dashboard, agents will be able to find agent training materials. So this is an area where we have added some additional documentation as well as short snippet videos in regards to features and functionality throughout the site. So if an agent is ever confused, they can always come to the Agent Training Materials tab to learn a little bit more. Also, always in the upper right-hand corner, the agent will be able to view their name. If I was to select my name here, I do have the ability to go into my account overview. A few important things that agents will find in their account overview, and I do like to stress to agents to always come here first, because this is where they will be able to view their active selling permissions. So the carriers that they are certified and licensed to sell through Health Plan Markets. That is extremely important because when they do get to the plans list page, they're going to want to be able to electronically quote as well as electronically enroll in those plans they are certified and licensed to sell. Also, within the account overview, agents do have the ability to upload an image of themselves. So any outbound communication from our system will include that image, so more of a personalized approach with the beneficiary. Also, agents will be able to find their own personalized shopping link. This is a copy link, so if we were to select that, we would be notified that it was copied. And we could send this link out to an individual in our book of business, and it would take that individual to the consumer-facing site where they could shop and enroll in a plan on their own. And if they were to enroll in a plan from an agent's personalized shopping link, that agent would get credit for the enrollment. So again, in the account overview in the upper right-hand corner, they'll be able to see their selling permissions, the ability to upload an image, as well as their personalized shopping link. Again, we do want to stress the searching of a beneficiary. So if we were to come in and search on someone named James, it will pull up every James in the system. As we do add more criteria to search on, of course, that search will get more specific. But say maybe, for instance, we're uncertain if the individual we're talking to has a profile built out. So we search on a first name, last name, date of birth, phone number, email address, and for some reason no results are found. we can actually create a profile off of the information we search. So just an area of streamlined workflow, making it very easy for the agents where they're not rekeying in information they've already provided into the system. Say here, we were to search on an individual named James Smith. Within the search results, we will be able to see here that there is one profile built out for James. And if we were to select his name, this is where we will be taken to his profile. One thing I do like to stress to agents here within the profile is actually to fill in as much information as possible, because information will pre-populate throughout the system, specifically when that agent gets to the carrier's electronic enrollment form. They're not going to have to rekey in this information again. It will populate on the first page of the enrollment form for them. Also on the right-hand side of the screen, we do have a call out to notes as well as tasks. So if there is something specific an agent does want to save to this profile, that can be done on the right. And again, any tasks that we do add here can be tracked within the agent dashboard. Also within the profile, agents will be able to see a quote history. So any electronic quotes sent to this beneficiary in the past, as well as enrollment history. So here an agent can actually view a past application. They could view that submitted application in a PDF form and maybe any documents they've uploaded to that enrollment. And as you can see here, they can continue on to an enrollment as well. So another area of streamlined workflow, making it very easy to navigate back to an enrollment form if they were to, say, leave a meeting with the individual, or when they now select continue enrollment, it will take them directly to that enrollment form where they could fill in the additional information and submit the app. Once we have gone ahead here and built out this profile, now at the bottom of the screen, we could continue on to collect the scope of appointment. We do have a few ways to actually collect the scope within the system. If the agents have their own scope form, they can upload that back into the system. They could print a consumer form and upload that back into the system, as well as we give agents the ability to send off an electronic scope of appointment, either via email as well as text. So again, supporting various options. As you can see, the email address and phone number have pre-populated from the profile. And if we did say want to email off that SOA, we would select the email SOA button, where we do have real-time notifications back into the system showing that that scope was sent. And we can now create a follow-up task on this scope, which can be tracked within the agent dashboard. Now, since we have gone ahead and sent off this scope, I will show you what the beneficiary would receive on their end. So if they were to go check their email, this is the email that they would receive. So, hi, James, I'm looking forward to meeting with you. Again, at the bottom of any email that does come from our system, that agent's image will be included, as well as their agent information. So if the beneficiary is ever confused, they can easily reach out to their agent. But here, that beneficiary will select complete scope of appointment form, where it will redirect them out to that electronic scope. And here they will need to fill in a few required fields. So the products they want you as the agent to discuss, their beneficiary information. So I'll go ahead and just enter some of this here. There will be an attestation at the bottom of the screen. And once they have entered all of the required fields, they can now go ahead and submit that form, where then you as the agent will receive an email letting you know that that scope was completed. If we were to go back into the broker site here now and just hit refresh on the screen, we will be able to see now that that scope was completed by James Smith. And now us as the agent will need to complete the rest of the form on the right-hand side of the screen, where it will pre-populate the agent's first name and last name, the initial method of contact, the plans that were represented during the meeting, an attestation at the bottom, And we can now go ahead and submit the broker form. We're again in real time showing that that scope was completed. And now us as the agent can view a PDF copy of that electronic scope as well. If we were to say send it off via text, it would operate almost the same, where that beneficiary would receive a text message to their phone with a URL. Once they do select that URL, they will be taken out to their phone's browser, where they will complete the same scope and submit it. Once we have gone ahead here, collected the scope of appointment, now at the bottom of the screen, us as the agent do have two options. We could begin to add preferences on the beneficiary, so take them through more of a guided shopping workflow. Or we could continue to plan first and get more of a high-level view before we start to add preferences. So I'm going to continue to plans first. This will take us to the plans list page. So the plans that that agent is certified and licensed to sell within this beneficiary zip code. Here, agents will have various options. They can look at the different plan types at the top of the screen. So if they're looking for a MAPD plan, MA, PDP, Med Sup, those will be broken out. They'll have different sorting options. So if they wanted to sort by plan premium, total estimated costs, plan name, those options are available. They could choose to view an individual plan's details. They could add to quote a plan electronically to the beneficiary. They could add a plan to cart and begin the enrollment process, as well as they can always choose to check up to 3 plans to compare side by side. However, again, this is just a high-level view of the plans. On the left-hand side of the screen, us as the agent do have the ability to go in and add preferences, which will take us to the Get Started page. Here it will pre-populate the zip code from the profile, what coverage type they're interested in, and then a subsidy level question. Again, what we do answer here will be reflected back on the plans list page. Next is health status. So the health status will be used to help us calculate estimated costs. It will not affect plan premiums at all. And we bucket this into 3 categories. So generally healthy, some health needs, and significant health needs. And we do supply the definitions to those right below for the agents to view, as well as age range. If we have entered their date of birth within the profile, this age range will pre-populate. So from this page, we are determining utilization of the plans. Next is providers. So we do have an integrated provider search within the technology now, where it will pre-populate the zip code, but giving the agent the ability to search on a specific doctor or facility, as well as they can always use the map to search a larger area, and it will pull those in. And here we do also have the ability to add up to 8 providers and designate which one is our primary care. So when we do move back to the plans list page, we'll be able to see if the providers we've entered are covered or not for the plan shown. Next is prescription. So a very important piece of the technology. We do have the ability to save a beneficiary's drug list year over year within our system. So building out this medicine cabinet in the beginning is extremely important. I do know drugs can sometimes be difficult to spell, so we do have a smart lookup tool making it very easy to search on those, where it will pull up the most common dosage as well as quantity. But of course, we can make those changes if they are taking something different. And if there is a direct generic available, we will show that direct generic and the ability to switch to that generic for likely savings. We do also have a second option for collecting the beneficiary's drug list, and that is through a connection with MyMedicare.gov. So if the individual we're speaking to does have a MyMedicare.gov account, we can use this connection. As you can see, their email address is pre-populated from the profile. And if we were to select send email, we would be notified we're waiting for access. And we can create a follow-up task on this as well, which can be tracked within the dashboard. The beneficiary will receive an email prompting them to log into their MyMedicare.gov account. Once they log in, they'll allow access back into our system. And once that's done, it will populate the last 18 months of that beneficiary's claims data directly into this window for the agent. So a really great tool if the individual happens to have a very large drug list where the agent isn't going to need to manually enter those drugs one by one. Whether we use that MyMedicare.gov connection or enter drugs manually, we can always come back to this window and edit a dosage or quantity. We could delete drugs out of the medicine cabinet if they're no longer taking them, as well as we can always continue to manually add drugs by using the Smart Lookup tool. Next is pharmacy, so looking a lot like the provider search, where it will pre-populate the zip code, or we can search on a specific pharmacy as well as use the map. And here now, we do have the ability to add up to 3 pharmacies and designate which one is our primary. So when we do guide back to the plans list page, we'll be able to see with the providers we've entered, prescriptions, as well as the pharmacies, if they are covered or not for the plan shown. Lastly are just some other preferences. So if there are benefits that are important to the beneficiary, such as hearing, vision, or dental, we can select those as well as maybe any chronic conditions that may apply. So when we do guide back to that plans list page, we will now have an additional sort option where we can sort the plans on a preference score from high to low. So showing this FlexCare MAPD Plan 6 does have a dental, vision, and hearing add-on. Now that we have gone through the guided help, we've landed back on that plans list page where we do still have the same options as we did before adding preferences, where we can now see those preferences on the left-hand side of the screen. We can always go in and edit any of these preference windows, as well as at the top of the screen under the beneficiary's name, a drop-down for each page of the system will show, so making it very easy to navigate throughout the site itself. But now within the plan cards, we are showing much more information. For instance, here with this top plan, we're showing 0 of 3 providers are in network, 1 of 2 prescriptions are covered. The Rite Aid pharmacy is a standard in-network pharmacy, but we did select 2 others, which we can see in the upper left-hand corner. So if we wanted to look at the prescription center, we can see that's standard in-network. Bowman is out of network, as well as we can look at mail order costs, as well as we are showing a total estimated annual cost. So showing a lot of information up front to the agents before they do dive into the specific details of a plan. As mentioned, we can always choose to check up to 3 plans to compare side by side by selecting the Add to Compare checkbox. And once we have hit those, we can hit Compare Now, which will take us to the plan comparison screen. Here it will check and highlight to show the plan differences across the board in yellow for the agents to view. And we break out the plan details into a few sections. So the costs associated with the plans, the plan benefits, the preferences we have added, so the providers across the board, the prescriptions, as well as the pharmacies and any other preferences we entered. And if there is any optional add-on coverage available, we can view the details of those add-ons. And once we do add a plan to cart, that's where we will be able to select from that optional add-on coverage. From this plan comparison page, we can send off a multi-plan quote. We could add one of these plans to cart to begin the enrollment process. as well as we could dive a little bit deeper into a specific plan by selecting Plan Details. This will take us to a one-off view of what we saw on the previous screen. However, there will be two other tabs at the top of the page for the agents to view. One being prescriptions and one being total costs. Underneath prescriptions here, the agents will be able to see what the drugs they've entered, as well as the pharmacy that is selected, a tier breakout, so where those drugs fall, along with the costs associated with each of those drugs under this specific plan. And under total cost, they'd be able to see that total estimated cost number and a breakout by month, so where those costs are going to fall for that beneficiary throughout the year. Agents can also filter this information off of the specific effective date. As mentioned, agents can choose to send a multi-plan quote. That could be done from this plan comparison page or from the plans list page by using the Add to Quote button within the plan cards. So I'll select 3 here. And once I have selected those, I can see those 3 plans at the top of the screen. If these are the plans I want to quote, now us as the agent on the right-hand side here will select Send Quote, where we will have the ability to send off this electronic quote either via email, text, or both. There will be an area for the agent to write a custom message to the beneficiary. And since we have selected more than one pharmacy, we do need to choose which pharmacy we want to send the quote on. So I'll keep the Rite Aid selected and now go ahead and send quote, where we will be notified back into the system immediately that that quote was sent successfully. And we can now create a follow-up task on this quote as well. Now, this is very important because it is for security reasons. The beneficiary will receive 2 emails, one being an authorization code and one being the quote itself. However, we will show that authorization code here for the agent to view, as well as back under quote history within that individual's profile. So if they are ever confused, the agent can easily assist them. Now, since we have sent off that quote, I will show you what that individual would receive on their end. So they've received here that one email with that authorization code. They'll either need to copy and paste this or write this down. And then the second email with the quote itself. So, hi, James, I have a quote for you. James here will select View Quote, which will take him out to a landing page. And on that landing page, he will be prompted to enter that authorization code he's received and then continue in to view the quote. Once he does access the quote here, he will be able to view a little bit more than just those 3 plans the agent has decided to quote to him. He'll actually have the ability to view all the preferences that were entered on him up until that point. Say, for instance, James here is taking a new prescription drug. He can add that new drug himself, and that new drug would be reflected within the broker site. And now he could go down and view those 3 plans that were quoted to him. Here, he could compare the plans side by side, just like we did as an agent. He can view the individual plan details just like we did as an agent. So seeing that prescriptions and total cost breakout. If for some reason these 3 plans do not fit his needs, he could choose to shop all available plans, which would only show him the plans that that agent is certified and licensed to sell, because the beneficiary does have the ability here to add a plan to cart and go through the enrollment process on their own. And if they were to enroll in a plan from a quote an agent has sent them, that agent would get credit for the enrollment. So this is a very popular method, especially since the start of the COVID-19 pandemic. having the ability to send this information off to a beneficiary, allowing them to digest it, and possibly making a plan selection on their own where the agent would still get credit. Say we have gone ahead, we've sent off the quote to the beneficiary, they've reviewed all the information, and they know what plan they want to enroll in, but they don't feel comfortable enrolling on their own. So they reach back out to us as the agent and say, you know what, this FlexCare MAPD Plan 6, that's the one for me. Us as the agent can select Add to Cart. Before we do hit the carrier-specific electronic enrollment form, we are sent to a cart where we can view the details of the plan we've selected, as well as change or remove the plan from the cart and select another. And this is where we can, again, view the details of specific add-ons and select from that here as well, where it will update the total monthly premium at the bottom. Once we have gone ahead and reviewed the cart here, now at the bottom of the screen, agents will have two options for completing this enrollment. If they are, say, sitting face-to-face with the beneficiary, they would select Complete and Submit the Form Myself. This would allow the agents to go through the entire electronic enrollment form, collect that beneficiary's signature face-to-face, and then submit the application. However, if they are not sitting face-to-face, we do offer an option to send to beneficiary to sign and submit. This will allow the agent to go through the entire enrollment form up into the wet signature, and they would not have the ability to submit the application. However, they would have the option to send off the enrollment either via email or text to collect that beneficiary's wet signature and submission. So again, giving agents as many ways as possible here to get their beneficiaries enrolled. I'll go ahead and select Send to Beneficiary to sign and submit and continue to apply now, which will take us to the carrier's specific electronic enrollment form. Each carrier's enrollment form will vary slightly. However, things that will remain the same, there will always be a progress bar at the top of the screen, as well as a shopping cart on the right-hand side, so just ensuring us that we have selected the correct plan. And now, as we move down onto this form, as you can see, a majority of this information has pre-populated from the profile, so saving us time where we're not re-asking information we've already collected. If we were to try to move on to the next page of the enrollment form and have not entered a required field, it will not allow us to move forward, so making sure we do have all of that correct information, as well as we do have areas of validation. So one specifically here being USPS validation. If we were to enter an incorrect address, a flag would pop, either telling us to continue on with the address we have entered or make a change to move forward. And then lastly here, areas of additional information, there are drop downs to supply that throughout the form. Next here will be benefits information, so the entering of the Medicare number. So I'll go ahead, provide that here. The requested effective date, special enrollment period reason. So these will be line items with hover over question marks, so breaking out some additional details for the agents if they do need that. And then per carrier's enrollment forms, additional yes/no questions will apply. Next is other information, so maybe some additional employment information questions, physician selection, and then how they'd like to pay for their plan premium. This will vary depending on what the carrier does support. Lastly here, review and submit, very important before we send this application off. So we have each page broken out in these tabs. If we were to look at contact information, we can edit any incorrect information. Again, each page will be broken out. And since we did select Send to Beneficiary, we cannot submit this application. But when we do hit Send to Beneficiary here, we can send off this enrollment electronically, either via email, text, or both. I'm going to go ahead and send this off via email, where this electronic enrollment will act exactly like sending a quote to the beneficiary, where for security reasons, they will receive one email with an authorization code and then one email with the enrollment itself. But again, we are showing that authorization code here for the agents to view, as well as back on James Smith's profile. A note has been added in the upper right-hand corner showing us that app was sent via email and the authorization code attached to that application. Now, if we were to go check our email as if we were the beneficiary, they've received now that one email with the new authorization code, and then the second email with the enrollment itself. So, hi, James, here is the plan we discussed. James here will select View Application, which will take him out to that landing page. And on that landing page, he needs to enter that new authorization code and continue in to the enrollment form. Once the beneficiary accesses the enrollment form, they will be taken directly to the review and submit. So making it very easy for them, where they're just going to need to review all the information the agent has entered for them up until that point. They'll need to agree to the legal terms with an attestation, and then this is where they will provide their wet signature. One thing to mention in regards to this site, it is fully responsive. So if the agent or the beneficiary needed to collect that signature here, if they were on a cell phone or a tablet, they could use a finger or a stylus. If we're on a laptop like I am today, that signature can be collected with the mouse. Once we've gone ahead here, provided all this information, this is where we can go ahead and submit the application, where we will be taken to a confirmation page. So this would be the exact confirmation page the agent would land on as well if they were to choose the option for submitting that enrollment face-to-face, where we can view the pending coverage, as well as some additional application details. So the date it was submitted on, the confirmation number for this specific enrollment, as well as the ability to view a PDF copy of that submitted application here as well. So both the agent and the beneficiary can view this. The beneficiary can download it, save it to their desktop, same with the agent. But that would take you from start to finish throughout the enrollment process. If we were to guide back into that broker site and just hit refresh on the screen, we'll see some updated information. We do have those notes again on the right-hand side showing us an SOA was sent via email. We sent off an email for the MyMedicare.gov connection, as well as the app was sent via email and that authorization code. We can see tasks that were created and closed out as we moved throughout the system. We could see that additional quote we've sent along with that authorization code. And we can now view the enrollment history. So the plan we've enrolled the beneficiary in, the date it was submitted on, the confirmation number, as well as the ability to view a PDF copy of this submitted application here as well. So the PDF copy of the application will look exactly like this, where the agent can save this, view the application details, as well as a page-by-page breakout of that application we completed. And then lastly, new this year, on the last page of the PDF, we have actually added all of the guided health preferences we've entered on this individual. So health status, prescriptions, pharmacies, providers, as well as any other preferences. So we can always reference this as an agent. So that would take you from start to finish throughout your broker site. If you do have any questions, I know Val will stop the recording now and we can get those answered for you. But really excited to get you all in the system for this AEP. Again, thank you so much for your time.